Hi there everyone, welcome. This is Joe Minardi and I'm just here to go over a little case with you that I posted a while back. So this was a middle-aged female and she came in with some pretty sudden onset lower abdominal pain, and so obviously some ovarian pathology was on the differential, so we took a scan of her abdomen or of her female pelvis via an endovaginal route. You can see here we got this tight curve and this wide field of view. So this is an endocavitary ultrasound, and a few things we saw in her pelvis. The most notable thing was this mass here, which you can see at first might almost look a little bit like an ovary, but the more you look at it, it doesn't really look like one. And then as you fan through, you start to see some features that are going to help you make a diagnosis here. So let me scroll here. So right here is one of the areas that I think is pretty interesting and pretty telling as you fan through. Right here you see a bunch of these different folds here. You see fold, fold. You almost get an idea of, it looks like maybe a snake is eating a mouse or something like that. So let's go ahead and keep scrolling through, and right here, so here we see something that's got a lot of different layers. You still see that kind of something sitting inside of something else. So what I'm hinting at here is this patient's got intussusception, which is not very common in adults. But what you'll see is you pretty clearly see these multiple layers of bowel, and as you fan through, you can actually see the intussusceptum telescoped inside of the intussuscepiens. Intussuscepiens is the outer part, intussusceptum is the inner part of the intestine. So this is a middle-aged patient with sudden onset pelvic pain who turned out to have a rectal intussusception, which is pretty rare. We know about this in kids. In adults, it's often related to some type of pathology like a mass, a tumor, a polyp, something like that. But we were able to make the diagnosis pretty quickly at the bedside with endovaginal sonography. So always keep in mind, most of the time we're looking at uterus and ovaries, but take a look at everything else that's going on. Sometimes you'll get other clues. Okay, maybe appendicitis can be found, other intestinal problems, vascular problems, but take a look at everything you see, and if you see something that looks abnormal, do some nice big sweeps through it, put some color on there, and you might be able to make even more diagnoses than you were looking for. I hope that was helpful, and thanks a lot. Thanks for paying attention.